Hi, my name is Jonah Rosado, and today I'll be demonstrating how to insert and take out a female urine catheter or Foley catheter. So first I'm going to make sure that there is a medical order for the catheter, and I'm also going to look at if there is any limitations in position or movement, so that way I know if the female can assist me or if I need to get assistance. After I figure that out, I will also gather my supplies that I will need. Once I've gathered my supplies, I will enter into the room and I will identify the patient as well as address myself. Once I do that, I will close the door and the curtains and I will begin to explain the procedure. I will explain that it is a discomforting procedure when the tube is going in, but it's in order to help and relieve her so she will ultimately feel better. After I'm done explaining it, I will assemble my things on my table. Also, I'm going to make sure that there's good lighting. Okay, after I do that, then I'm going to adjust the bed to a comfortable position, which is around elbow height. I will also ask her if she's allergic to iodine or latex. Then I will lower the side rail and put on my gloves. Then I will expose the area that I will be working with only. And I will grab my bath supplies. Also, I will make sure that there is a waterproof truck underneath her, so that way the water doesn't get on the sheets or anything. So I will have my wet rag, and then I will also have my dry one so that I can clean her off. So this will be soap water, make sure it's warm, not too hot, not too cold. And then I will begin I will open up and then I will begin from top to bottom, making sure to change it every time. Okay, then we're done, so I'm going to pat her dry. Okay, so now I'm going to dispose of this, and I will take off the gloves. Okay, now I will begin to set up my sterile station. Okay. I'll be using this to dispose of my cotton balls. I'll make sure to put this over here. Okay. I will keep this in case I need to refer to it for anything. Okay. Now I will open it carefully, making sure to only touch the edges. Okay. Next I will grab my gloves, making sure to only touch the outside. Alright, now I'm going to set up my sterile field. So first thing I'm going to grab is this, making sure that the shiny side is down. Usually I would do like an airplane, kind of like covering my hands, but we're just going to ensure that it's under the patient as much as possible, also ensuring not to touch the patient. Okay, so we also have this one, but we will not be using this one today, so we're going to just put it here on the side. Next we're going to be using this, which creates an enlarged sterile field, as well as just making sure the shiny side is down, also making sure that we do not touch the patient during this time. Okay, now we're going to put this here. We have established that the patient is allergic to iodine, so we will ensure that we are not going to use that one. So we're going to put it over here. Then we would open it, pour it on the cotton balls. Next, we will open up our lubricant. We will lubricate that area. We will not be using this, so we're just gonna toss it out so it doesn't get in the way. Okay, next we are going to grab our tube. This would have a wrapping on it, and I would carefully remove that. After that, I would attach the syringe. Okay, also I could inflate it at this moment to ensure that it is working, but I will not do that for this procedure. Next we will put the tip in the lubricant. Again, ensuring that it does not touch the patient. Okay. So now at this moment, I'm going to establish that this is my clean hand and this is my sterile hand. So once I put it on the vagina and I open it up, I have to make sure that if I let it go, I will need to clean it again. So I will open it up. I will grab my hand. Just one swipe and dispose of it. One swipe and dispose of it. One swipe. Okay, and also dispose of this. Okay, now that I have lubricated the tube, I will begin to insert it, but first I will instruct her to take a deep breath, that it will be a bit uncomfortable, and I will make sure to insert it as quickly as possible. Okay, also make sure you're doing this process, like you don't want to push it in or harm the patient. Unfortunately on this mannequin, it will not enter that deeply, but you will, when you see urine, that's how you know it's in. And when that happens, you will begin to press in the fluid.
I think it's because based on the dogs is like,
yeah, you set it up, since you seen it set up, the way she set it up, everything in the container, you did a better job.
Yeah.
You did. Yeah.
She took her time though.
Yeah.
And you were thinking about what you were saying instead of just saying it.
Yeah, I feel like, because I was most comfortable with the
Okay, so now remove it
yeah.
and throw that away. Once I do that, I will pull it until I feel resistance. Okay. Once I do that, then I will attach it to her thigh. I'll make sure there is some slack so she's comfortable to move. And then I will attach the bag to the bed. Then I will dispose of all of this. Once I do that, I'm going to make sure that I cover up. I will take off my gloves. Okay, then I will adjust her bed to the lowest position. And I will put up her side. Also, I will put back on my gloves if I needed to collect a specimen, but we do not need to do that. Now I'll be saying how I would take out the catheter. So first, of course, I would make sure that I have a order to remove it. After that, then I would explain the procedure. I would go through the steps of putting on PPE and washing my hands. After I do that, then I would adjust the bed for her. So I would hire it to highest level, as well as lower the side rail. Then I'll put on my gloves. Okay, then I will expose patient. Okay, and now that I have done that, I will look at the contents of the bag. I will describe the color, if there's any odors, clots, whatever is going on. I'll chart that. I also chart the output. Once I do that, now I can take out the catheter. So I'm going to grab a clean syringe and I will deflate the balloon. So all the liquid is going to fill up. Just for time purposes, you would never do this with a real patient. You wouldn't like pull on it. But just for time's sake, we're going to deflate the balloon. Okay, so once you do that, you remove it, dispose of it. to instruct her again to take a deep breath and coil it up. Remove it, then I'm going to wrap it up. And I will dispose of it. Then I will clean up any other garbage that there is, making sure everything's nice and clean. Offer her personal care, hygiene care, to clean the area, make sure it's clean. Then I'm going to cover her up. I'm going to remove my gloves. Okay, so after I'm doing that, then I will lower her bed. And tie up my side rails.